found in human stomach beneath the gastric mucous layer adjacent to the gastric epithelial cell. Transmission by ingestion through contaminated food and water. Diagnosis nowadays mostly depend on serological tests, but there is many other tests such as gram stain and culture and Urease-positive tests. Urease-positive tests used in endoscopic procedure by taking part of a mucosa and put it in special tests contain urea and indicator which is phenol red. If the medium or this test become red, mean urea is degraded by urease test from the bacteria, and phenol red will give the indicate of reaction. Other test is urea breath test, and this test depend by take a patient capsule contain urea, and this urea composed from isotope of carbon, and when the bacteria is found will degrade the urea and will give carbon dioxide, and this carbon dioxide will be detected in the breath of the patient. The treatment will be Amoxicillin and metronidazole and proton pump inhibitor. Prevention, there is no specific vaccine is available for H. pylori. Other infection will be talk about hepatitis B virus, and we must know that about only 5% of infected patients will become chronic carrier state, and the injury to the hepatic cell occur not due to the virus but due to immune attacked cytotoxic T cell which is CD8, and there is arthritis and rash glomerulonephritis due to antigen antibody complex that is deposit in different parts of the body, especially kidney, joint, and skin. And chronic hepatitis, cirrhosis, hepatocellular can occur. And high rate of carcinoma occur in chronic carrier. And it is found that hepatitis B virus genome have no oncogene, that is mean have no gene cause cancer. And so the cancer can be result from either persist cellular regeneration that attempt to replace the dead hepatocyte, or malignant transformation could be the result of insertional mutagenesis, which could occur when the hepatitis B virus genome integrate into the hepatocyte DNA. Integration of the viral DNA could activate cellular oncogene, lead to the loss of growth control. This means normally human cell there is no oncogene, mean there is no gene causing cancer. But when the virus DNA insert to the proto-oncogene, and we know that proto-oncogene is genes that control the growth of cell. So this proto-oncogene will be changed to the oncogene and lead to the cancer formation. Hepatitis C virus is also similar to the hepatitis B virus, as it is caused chronic infection and increased risk of virus hepatic carcinoma and cirrhosis. and also the injury caused by cytotoxic T cell, and more than 50% of infections will lead to the chronic carrier, and compared to the hepatitis B virus only 5%. And the patient also, chronic carrier, will be predisposed to chronic infections, chronic hepatitis, cirrhosis, and hepatocellular carcinoma. Hepatitis C virus infection strongly predisposed to hepatocellular carcinoma, but there is no evidence of oncogene in the viral genome or of insertion of copy of the viral genome into the DNA of the cancer cell. Alcoholism increase rate of carcinoma and in infected patient. This supports idea that cancer is caused by prolonged liver damage and the consequent rapid growth rate of hepatocyte as the cell attempt to generate rather than direct oncogenic effect of hepatocellular of hepatitis C virus. Thank you.